Gibbs Reflective Cycle and Nursing Leadership. Introduction. In healthcare, nursing leadership is critical in influencing the overall health outcome. The activities involved in patient care are repetitive and tiresome, sometimes making nurses exhausted and unable to deliver the best quality services. In such conditions, they require a nurse manager able to inspire and motivate them to work towards achieving the objectives set. To ensure all the processes run effectively in the organization, the leader must reflect on the various encounters to improve decision-making and management. By relying on Gibbs' reflective cycle, the nurse manager will be able to effectively scrutinize experience and establish a proper action plan necessary for better service delivery. Description. One night at around 11 p.m., when I was at home relaxing, I received a phone call from a nurse on the night shift team informing me that other providers refused to attend to the patients. I had already planned the schedule and assigned each of the practitioners their roles. I was forced to report and assess the situation at the hospital immediately. Several patients did not receive their routine medication, and I had to give it to them despite lateness. Feelings. I felt scared knowing how missing medication could worsen the condition of patients. Before I left the healthcare facility, I was confident knowing that I had arranged the night shift program for the providers on duty. The nurse who reported was confused and overwhelmed with duties during the situation. The scenario made the majority of the patients feel that care services were not properly given. During the phone call, I thought most sick individuals would be reactive due to poor services. Later, I asked the nurses why they had not attended to the patients, and they said they were tired. Evaluation. The occurrence made some of the patients change their medication to enable them to reverse the condition. The incident made me understand the value of motivation to staff workers and how it affects their performance. When I arrived, I found the active nurse had given the majority of patients their evening doses. As the nurse manager, I convinced and promised the providers to go slow and better working conditions to improve their participation. Analysis. Work burnout is a serious issue in the healthcare setting, and management must formulate effective ways to manage it. Without proper motivation, providers are more likely to become unresponsive. From the incident, I realized that it is important to cater to the well-being of nurses to keep them inspired. Nurse leaders should always be within the facility to intervene immediately. Conclusion. If I had acted before to motivate the nurses either through a balanced work schedule or other benefits, the incident would not have occurred. It is now clear to me that I failed to act on my capacity to create proper working conditions to prevent work stress that limits providers' participation. I have realized that as a leader, I must support and ensure nurses' needs are met to enable them to remain active and ready to work. Based on the incident, I will ensure that I motivate and engage staff members by inquiring about the challenges they are facing that might hinder their service delivery. Such involvement will allow me to prevent situations that risk the lives of patients. I will further establish a proper routine so professionals have adequate time to relax and refresh their minds to lower issues of burnout.